Today we have a guest speaker who has been here with us before. Her name is Valerie Lewis, and she is actually from New York. Her title is she's the Administrator of Outreach Services and American with Disabilities Act Liaison at Suffolk Cooperative Library Systems. Valerie, welcome back.
Thank you for having me. I'm so excited to be here.
Your topic today is Vision Resources Aging in Place.
Just to give you a little background, I have worked at the Suffolk Cooperative Library System for close to 30 years at this point, and have worn many hats, most of them having to do with access services for people living with disabilities, and in particular, people living with vision loss. And so what we talked about, for me talking with you about today, is some of the things to keep in mind, that not only if you're experiencing vision loss, but things to think about, before you experience vision loss, but also not to be frightened or hesitant to look for services if you are experiencing vision loss. It's very common as we age to experience some level of vision loss, people over a certain age. And then there are a lot of different eye conditions out there in the world. And I will say, and you will see within my presentation, that I am not a healthcare professional. I do not offer any type of healthcare advice or healthcare services. What I do offer is some information on resources where you can find services for vision, understanding vision, and then accessing the types of services that will help you to continue living as independently and productively as possible as you age and as you may experience any type of vision issues. My contact information is here on the screen, and really the best way to reach me all the time is through email, and that is valerie@suffolknet.org. So one of the things that that I'll state again is that I am not a healthcare professional. I cannot answer any medical questions about eye conditions or different health conditions, but my experience working with disability-specific types of resources and vision-specific resources over the past 30 years, and also having had much training in terms of access for people with disabilities, the Americans with Disabilities Act, and other disability legislation, helps me to help you better understand how you can access services if needed. Things we want to think about. General vision care, right? Do you visit your eye doctor regularly? Really important. Not only are there eye conditions that can be spotted by visiting your eye care professional, but they can also spot different physical health conditions just by visiting an eye care professional. There are different types of eye conditions, and we'll touch on that as we go through the presentation. Vision terminology. A lot of people use a lot of different terminology when it comes to vision-related conditions and situations. So it's helpful to understand the different vision terminology, how vision impacts daily living, because daily living certainly becomes impacted by vision loss. And so you want to understand how it becomes impacted. You want to make sure, and as we go through this, we'll talk about it some more, that you involve and include people around you. Many times when people are experiencing vision loss, it creates isolation and it creates a fear and embarrassment. And so we want to make sure that people are staying in touch with those around them. We want to also make informed decisions. So there's a lot of information out there that you can get from doctors, that you can get from different healthcare environments. Certainly, you want to utilize your public library wherever you are. And also, you want to utilize health science libraries that may be within a hospital near your geographic area. And that will help you to make a more informed decision. And then you want to be adapting to aging vision, right? Not everything is so severe, but even minor types of changes, you want to be able to make those adaptations to as you experience the changes. So here we have some just vision types of basics to keep in mind. And so when we talk about vision care that we mentioned on the previous page, you want to pay attention to vision changes because those changes are telling you something. And it could be telling you something minor, and it could be telling you something more complex. So pay attention to the various changes you might have. Again, seeing an eye care professional on a regular basis is always recommended. And then the challenges of visiting eye doctors in today's world, right? So everything is so rushed whenever we go to any kind of a doctor's environment. It's important that we take that extra step to make someone stop and kind of speak to us and take that extra couple of minutes to explain things to us that they explained to us, but they explained it in a way that they understand, but they may need to explain it in a little bit better way for us to understand. And that's a huge challenge when visiting healthcare professionals today. So we want to make sure that we are in control of that situation and making that extra time to get the information we need and want before we leave that office. And then we also think about asking for the information in formats you can use. So if they give you information about your condition, or they give you a printout of your next appointment or a printout of an overview of your visit, you want to ask for those things in a format that works for you. So if you need a larger print, then you should request that in a larger print. If they don't have that available for you on that day, then you explain to them that you are happy to have them make a larger print for you and mail it to you. So that you can have information that's important to you that you'll actually be able to use. If possible, you always want to bring a family member or a friend with you, and that applies to everybody. It's not just an aging thing. We go to different offices and I hear one thing, the person I'm with here's another thing, and then hopefully we can kind of combine those things and then understand what it is that we were told. Or while we're still there, one person is hearing one thing and another person is hearing another thing, so we can ask about clarification on those issues. Again, I'll mention public libraries. I don't think people realize the value of their public library in terms of accessing an incredible amount of healthcare related information, and librarians who can help you find the resources that you're looking for. I think it's incredibly important that that be one of the starting points when you're looking for information, because they also carry out to other public libraries in the area or across the country to be able to find the resources that you need. So that should always be one of your first stops when you're trying to research something about information that someone has shared with you. You also want to reach out to appropriate organizations and agencies. So if there are vision-related organizations in your communities, you'll want to reach out to them. Different agencies through the state often provide information about vision resources. So things like a state commission for the blind or a local office for the aging, they would have different resources that would be able to guide you in the correct direction. And then also, hopefully locally or online, you can find a vision support group so that people who may be experiencing the same types of vision challenges that you are having can give you some tricks and tips about being able to get the resources you need, find the information you need, and also, again, how to live your daily life with certain strategies that you may not be aware of. So then we could talk about common eye conditions that you always hear about. And these are just kind of a listing of general eye conditions that are often out there that may cause different vision loss in different ways to people's daily lives. So there's just general aging eye types of vision challenges that people may experience. You may be new to eyeglasses. You may be having dry eye types of things. And those are all just, things that, again, kind of regularly seeing eye doctors that you can address. Macular degeneration, diabetic retinopathy, glaucoma, cataracts. And then there are also eye conditions that are caused by different medical conditions that can impact the level of vision that you have and how that impacts your daily living needs. And then different vision terminology. So people use different terms, sometimes interchangeably, but they do mean different things. So when we talk about vision loss, that's just kind of a general term that is used. I'm having vision loss, and it's used for many, many different types of scenarios. And then people may use more specific terms like I'm visually impaired. And so then again, they're having difficulty seeing things. It's something is impairing your vision. And so they'll use the term visually impaired. Legally blind is a more technical term where if your vision is 2200 or worse with corrected vision, that means even if with eyeglasses or contact lenses, your vision is still 2200 or worse, then you would be considered legally blind. And there are different aspects of that too. When you are legally blind, it can mean many different things. It can mean that you have some vision. It could mean that you have very limited vision. It could mean that you have no vision at all. So the term legally blind is broad, but you do have to meet a certain technical criteria to be considered legally blind. And that's important because often for state services or for social service benefits, the different terminology is very important, and often, and not always, but depending on where you live and how they utilize the different services, you may need to fit in one category or another in order to receive certain vision-related services from a state agency in your geographic area. Often a person may just be considered blind, That typically means when someone has no vision or they just may have light perception. So they have no vision, they can't see light. So the light will come through, but anything that they might see might be foggy or blurry. A good example of that is kind of behind me, right? So I have the screen blurred, and you see that there's kind of something there, but you can't really make out what that blurriness is. So that different levels of being blind as well. And then there's a term that's often used, which is deafblind. And again, that doesn't necessarily mean that a person needs to be totally deaf or totally blind. There are different conditions out there that may cause people to lose vision and hearing over the course of their life. So they may be considered deafblind. Some people are born totally deaf, totally blind, which, as you can imagine, might be quite challenging unless they have the appropriate tools at their fingertips and strategies that they've developed over the course of their lives to be able to, again, live as independent and productively as possible. And then daily life vision basics. So daily living, what does that mean? We get up in the morning, we brush our teeth, we get dressed, we make breakfast, we go out into the world, or we're a homemaker. We have our daily living kind of routine. So when something begins to impact that routine, we then need to find useful tools and strategies that will help us to continue being able to do all of the things that we want to do. Realistically, if we experience vision loss to a severe enough level, there will be things that will be impacted. But we also want to know that for the most part, with our daily living needs, we want to be able to handle them independently. That's our goal usually in life. We want to be able to continue to be able to live the life that we have lived and not really rely on other people all of the time. And so there are ways that we can do that. So in terms of daily life vision basics, first of all, there's the healthcare aspect of it that we talked about already. Doctors and healthcare, and what they will do for you is they will tell you the what, why, and how of the condition that you are experiencing, right? So they will talk about you have why you have it, hopefully, and how it's impacting your life. And then other things that affect our daily life are more things within our world, our immediate world. So lighting. We may need to change the way that we look at lighting our houses, the outside of our house, the office that we work in. We may need to increase or decrease the brightness of that environment. We may need to look at some of the new lighting technologies that are out there, lots of daylight resources, different types of colors of lighting that may make it easier for us to be in an environment based on the lighting. We may need to look at what kind of night lights we have in our house for safety purposes, so that when we have things like motion sensor night lights and things like that, right by the bed, things that are going to light up as soon as we get up, then we can have that extra level of safety based on different lighting. Automatic lights, things that come on again through motion sensor, through timing, things that come on. There are light bulbs in stores now. They are dusk to dawn lights. So you put them in, they come on as soon as it gets dark outside, or even in your house, if you keep it near a window. And then as soon as it's dark, the light comes on automatically. And then when it's light again, the light goes off automatically. And these are inexpensive, easy, automatic ways. There's smart lighting so that you can have apps on a Kindle or apps on a phone where you can turn the lighting on before you're going to get to that location, or before you're going to go into a certain room. So you can use things like smart lighting. And then also things just about general lighting. Do you need more bulbs in your house? Do you need different types of bulbs in your house? Do you need them in different locations? Do you need to move a lamp? Do you need to get more lamps? So all different types of decisions that you can make as you see the changes that you need to make. And then the last thing is lighting on our different devices. So many people have smartphones, many people have flip phones, and all of these devices, there's a flashlight option on. So even if you can pop that on for a minute, they sell lots of mini flashlights out on the market, and you can buy a little mini flashlight that you keep in your pocket all the time or on your keychain. And that way you're able to have that instant lighting in front of you. If it gets dark, if you're out later than expected, all these different scenarios that may occur. You also want to know your surroundings, both inside and out, right? So if you're in a new place, that's difficult. But if you are in your space, in your house, always knowing your surroundings, particularly if you're in a newer place, and also if you are outside of your house, making sure lots of times weather will impact if something has fallen over, something has blown down, and you want to always be aware of those indoor and outdoor kind of environments so that you can be safe, particularly if you're experiencing some kind of vision loss. And then furniture is important. The types of furniture that you buy, is it easy to get in and out of? Sometimes we get these electronic chairs and couches, and we kind of get trapped in them sometimes. Right? So making sure that we're able to use easily the different types of furniture that we get. Where are we placing it? Making sure that we can get around that furniture easily. And then, just placing it in places that are not going to be an obstacle to us. And then highlighting, like, if you have a certain colored carpet, maybe it's helpful to have, if you have a darker carpet, maybe it's helpful to have a lighter furniture or furniture cover color. The contrast is helpful to you when you are moving around your environment. And then different ways to highlight things within your world, right? Even if things like doorways become problematic to you, and maybe that sounds funny to some people, but doorways can become problematic if vision is a little blurry and things of that nature. So possibly changing the color of the trim on a doorway could be very helpful, maybe making it brighter so you can see more easily to get through. Tape is lots of different colors of painter's tape, so that doesn't damage your walls, but it gives you options of seeing different colors so that you can highlight things more easily. If you're writing or you want to mark things, big black markers are helpful. To make things high contrast is helpful, so different color things that you do throughout your environment, and then tactile options as well. So tactile options could be just even using some glue on something and it'll harden if you make a dot. Different companies, and on Amazon you can find different tactile dots and things that you can use on microwaves so that it can give you a little bit of a guide when you're trying to find buttons on the microwave. It doesn't see braille, it's just little raised dots. You can put these things on things like washers and dryers if they have knobs, so you can line things up and just make things a little bit easier that you're going to tackle throughout the day. So different ways to do things. You should also be thinking about the different mobility devices that you're using, right? So if you are using a wheelchair or a walker or a scooter, do you need to add some safety features to those if you are experiencing any kind of vision related issues? And then thinking about, is cycling maybe an option or not an option, depending on your vision, your safety, other people's safety, and certainly always considering, right? A lot of people will always say to me, well, I only drive in my own neighborhood, or I only drive locally because I don't see as well anymore. And I always say to them, well, then you're only hurt your neighbors, right? So it's just something to think about. If you can't see to drive 50 miles, you can't see to drive 5 miles, right? It's important to always keep that in mind, as distressing as that might be. And I do understand. So we want to, again, think about involving and including people around you. So oftentimes people will say to me that they feel isolated when they start to experience vision loss. And that's very reasonable because you sometimes can't get out as much. If you don't live in a walkable area and you relied on driving and you're not able to drive, then you cut back on the places you're able to go. And that does certainly then add to the feeling of isolation, right? So we want to try and include and stay involved with people around us so that we can still attend different things that we've always attended, going to synagogue or church, attending different volunteer events or going to the theater or whatever that might be, right? So we want to make sure that we do that. And we want to use a variety of strategies to meet your daily living needs. So you may need to look at different ways that you can do things. And again, that might include other people. You may need to get someone to help you with your mail. You may need to get someone to put together some lists for you or do the painting of the doorways around the different rooms in your house to create that contrast for you. So you should always make sure you're, again, involving and including people around you for all of these different things. You want to ask for feedback from others who are living with vision challenges, as I mentioned before. This is not a unique situation. You most certainly feel it's unique because it's happening to you. And it's very overwhelming when it's happening to you. And so you feel, well, nobody understands, they don't see what I see. But in fact, vision loss is experienced by almost everybody to some degree or another. And so you could even ask someone who might be younger and they wear glasses, so they wear contact lenses, ask them to do something for an hour without those eyeglasses or contact lenses, because they're probably quite visually impaired without that tool that they're using, right? And so they may be able to get a little bit better understanding of what you are experiencing. And that can be very helpful to you, and it can be very helpful to them as well, right? So you don't want to feel like you're in this all alone. Many people will say that they're embarrassed when they start to lose their vision. And again, kind of the isolation and the embarrassment goes together. People say, I don't like to go to weddings because the tables are big, the music is loud, I can't see who's talking to me, and I just kind of sit there alone. I don't know if they're talking to me, they're talking to someone else. I can't see who I'm talking to, so I just rather not go to these things. But if everyone understands that you don't see well, and everyone understands the music is blocking out you hearing where the sound is coming from or who's talking to them, they'll get up and they'll come over and they'll talk to you and they engage with you. And they'll also be able to assist you in getting your food if it's a buffet or, something like that. There should be no level of embarrassment to go through a process that we all really are going through at one point or another in the life cycle, right? So always keep that in mind. Ask for items that you need and can use. Again, I mentioned that before with healthcare resources, maybe large print, something of that nature, but anywhere that you are. If you can't see the menu and maybe they don't have a large print menu, then you can always ask a server to go through the menu with you. Maybe they won't need to read every section to you. Maybe they will. Maybe you don't eat pasta. Maybe you don't eat fish, right? So you can eliminate those sections of the menu. But 99% of the time, someone is going to be very happy to just go through the menu, tell you what they have, read you what's involved, and that way make your life a little easier so that you can, again, participate in the things that you have always participated in. You want to think about all aspects of daily life and how you can participate in them safely. Not just do them, think about how you do them safely. Again, things like if you're not able to drive, please don't drive, right? And if you're not able to cycle, don't cycle. Find other ways that may be useful to you to be able to get around. It may be a ride from a friend. It may be a ride from an organization, right? There are different organizations. Different areas have paratransit services, which are buses, pick you up at your home and take you to your location and then pick you up there later on in the day and bring you back. So you want to look for other options that allow you to continue to participate, but always thinking about how can I do it safely in regard to any vision loss that I may have. Flipping it around now, you want to share your experiences with others who are facing these challenges, right? So your situation, you're going to have some unique challenges. You can share that with others, and that may help them find resources that you couldn't find early on and find little strategies that you didn't know about early on. So that's something to always think about too. And quite honestly, that always helps you to get through a situation a little bit better if you are able to help somebody through the situation as well. We see that often in different types of volunteer organization types of situations. And then again, just ending with this again, see what kind of public transportation options are in your area if you do need to get from one place to another and you don't feel that you can do it safely by using the traditional mode of transportation that you've used your whole life. I'm going to briefly talk about a resource. And, this is a whole presentation in itself. So I'll briefly talk about this resource. Many people have challenges being able to continue to read. So we want to always look for resources that are going to be able to keep us up on the news, up as part of society, being able to have conversations with our family and friends, being up on the latest book or the latest movie or whatever might be out there, right? And so one of the resources that is incredibly valuable is called the National Library Service for the Blind and Print Disabled. This is a resource that is part of the Library of Congress in Washington, D.C., but there is a network of libraries, part of the National Library Service around the country. And what this service provides are books in audio and Braille formats. So let me just say that most people who become visually impaired do not necessarily learn Braille. Braille is a language unto itself. And while there are many people who use Braille, there are typically people who have learned Braille at a young age if they were born blind, or if they needed to learn Braille throughout the course of their life. So, but as we get older, there are different resources we can use, and they're audiobooks. So the most prolific way to find books in an audio format is through the National Library Service for the Blind and Print Disabled. It is basically called the Talking Book Program. There are talking book libraries across the country that serve different geographical areas. There's not one in every town like you will find public libraries, but they serve larger geographical areas. And that is because the Talking Book Program is primarily done either through the U.S. Postal Service, where the book cartridges, they're not books, they are cartridges with audiobooks on them. That is sent through the United States Postal Service, but it can also be downloaded onto a tablet or a phone or a device that's been designed to play talking books. So they have over 300,000 titles of books. And when you are part of the National Library Service for the Blind and Print Disabled, you also have access to other resources through programs like Bookshare, Learning Ally, which is primarily academic materials in accessible formats, Newsline for the Blind, and also you can access different reading materials and downloadables on devices like Alexa and other Google types of devices that you can talk to, and then they can talk to you. If you're new to those types of devices, you do want to understand how they work, so that you want to be cautious when you are providing information to those devices and they're providing information to you. So a little research should go into that. And then what I'll point out again is the public library. Public libraries have large print books. Public libraries offer downloadable books, depending on what area of the country you are in. And they offer a wide range of reading options for people living with vision loss. And they also have access to registering you with the Talking Book Program in that regional area. And they can also work with you to get those books through the mail, or to help you understand how to download the both the digital books through the public library and through the National Library Service Talking Book Program. So as I said, that's a whole really workshop in itself, but to find your local talking book library, I've included the address here, the website address here, and you can access that and find your local regional library. And you do not have to be blind. Please note that if you have any type of vision loss, if you have a learning disability or a reading disability, and if you are a person who has a mobility disability, which prevents you from comfortably holding a book or turning a page, you would be eligible to use the National Library Service Talking Book Program. So please do get in touch with them to find out more about their services. Here we have some resources for people living with vision loss. I will point out this is a very select kind of list of resources, because you will find things locally, but here's how you can get started on a more nationwide basis, and then it will bring you down to lower, more community level services when you go to some of these sites and access them. So the American Foundation for the Blind, National Federation of the Blind, American Council of the Blind, and then on a local level, you can look for rehabilitation services through the city, the county, or the state. low vision specialists that are typically eye doctors that have had extra training so that they can diagnose low vision, and they can also prescribe different types of magnification tools that may help you to do different daily living tasks. Reach out to different Lions clubs in your area, vision support groups, independent living centers are all around the country. They are usually located county by county. Regional library service for the blind and print disabled, as I just mentioned, the Talking Book program. They'll have resources for you. And then again, your local public library, who is going to be able to help you find community organizations, audio resources that you'll be able to use, and different types of organizations locally in your community. And then daily living and technology resources. So different daily living items that you can purchase that can make your life a little bit easier. You can find in different types of catalogs, and some of those items might be things like magnification devices, not the traditional like 2 times magnifier that doesn't magnify all that much, but more robust magnifying options. You can find things like talking watches. You can find talking alarm clocks, different types of devices that are tactile, and you can find these things. One of the companies that you can look at is Independent Living Aids, which has a website and catalog. Maxi Aids also has a website and catalog. You can even go on to Amazon and eBay, and when you can then compare prices and see, looking at the different things that you are finding, you can see what is the best option for you in terms of purchasing these devices. There are different types of electronic magnifiers that are out in the world. Some are tabletop and some are handheld, and those could range anywhere from a couple of $100s to several $1,000s, depending on what you're looking for and what will suit your needs in terms of either your daily living needs or if you're in a work environment. So you can, again, compare those types of things that are out there. And then you want to look at purchasing things like talking devices. Again, if you're struggling to see something, then change the way that you are trying to see them. Don't look at them, listen to them. So talking devices, again, like watches, alarm clocks, different devices throughout your home that you can now make talk to you. Things like the thermostat. They sell talking thermostats. So something like that you can use in the house rather than trying to struggle and see things that may not have the good contrast for you. Tactile devices, again, they call them locator dots, they call them bumps, they call them raised dots. You can find these kinds of things. They're self-adhesive. You might put a few of them on your microwave, on the buttons that you use most often, on your washer and dryer, on other types of appliances that you have throughout the house, to label one light, put it above one light switch so that's the outdoor switch as opposed to the indoor switch, right? And it just gives you little tactile ways of finding the different things you need more easily. Again, watches and clocks, and using different highlighting resources we talked about before, and certainly having things like markers, black markers, and white paper. So if you want to make yourself a list, often what will happen is all of our lives we've written with either a pencil or a pen. And so we continue to write with a pencil or a pen, even though we can't see it. And they were like, I can't see what I wrote. So get big black markers, get lots of paper, and that way you can write lists, appointments, phone numbers, people's addresses, and you'll be able to access it very easily without struggling. So, don't worry about pens and pens. Go out and get some markers and things like that. Be aware that smartphones, tablets, computers have what are called accessibility features in them. So if you go into the regular settings, under settings, there's accessibility settings. You can always change the contrast in your phone. You can change the font size of things on your phone. Many people have 30 icons on their home screen. You can leave 6 icons on your home screen of the things that you access most and move all the other things to a secondary screen, right? There are many, many ways to customize our phone. You can have the phone talk to you. You can talk to the phone rather than struggling with dialing. So go in and play with some of those accessibility features, or get someone who's 17 years old to go in and help you with those accessibility features, because they understand all the ins and outs of all these smart devices, and see if any of those different types of accessibility features make your daily living experience any easier.
I was happy to hear that you don't have to be like completely legally blind or have, the diagnosis. If you can just kind of show proof. Do you have to show proof that you have disabilities in order to get those type of talking books or a special type of research you mentioned?
So what will happen with the talking books is you will contact, you can go online. So you can go online to the web address that I shared. And then that will take you'll basically type in your address, and that will take you to your regional talking book library. Let's call it talking book library. In the inner world, they call it NLS, for National Library Service. And once you go to your local regional library, there will most likely be a website. There will be an application. And some of them are making the application fillable online, but most likely you will print out the application. Depending on your situation, you just need to have the application certified by, it could be a librarian. So if you typically borrow large print books from your library, or you have difficulty with using the books, as I said, because maybe you have difficulty using your hands, turning a page, maybe you have arthritis, maybe you have difficulty with any kind of mobility in your hands or your arms, and you just cannot support holding a book. A librarian can certify a talking book application. A healthcare professional can, a social services provider. Many different organizations can certify that you have some type of need that would make you eligible for the talking book service. The National Library Service wants people to use the program. And I think the reality is, if you're sighted and you're well enough and you can use traditional print books, then you will, because you'll have much more of a selection of books in the world. And additionally, if you have access to downloadable books in your public library, you also have an amazing amount of resources. You have, access to downloadable books and magazines and music. And so if people are seeking to use the talking books, the National Library Service wants to make that process easy for you and give you as wide a spectrum as possible of people who can certify that application, right? And so you put the information on the type of difficulty you might be having in terms of using the books. Even think about a person who may be in bed all the time, unable to sit up comfortably. And the talking books can provide people with a puff and zip switch for the device. So if you are quadriplegic and you cannot use your hands or any part of your body to turn the machine on and off, they provide a puff and zip switch. And so even depending on the physical disability, you are able to use the talking book program. In regard to vision, if you have difficulty seeing and you cannot use a traditional print book, you don't have to prove that you can't use a large print book or anything like that. If you have difficulty reading a traditional print book, for whatever reason, then you can apply to receive the talking books. And again, you might get the container that holds a cartridge. It looks like a cassette tape for those of you familiar with cassette tapes. Looks like a cassette tape, but only has a hole on one side, and then there's a built-in thumb drive in the other side. So, and that slides into a machine that the National Library Service provides, and that comes through the mail. But many people don't even get their books through the mail anymore. A lot of people will download the books, as I said, through the National Library Service website, and have access to their books that way on their smartphone, on a Kindle. There is no print and there are no visuals to this. It is audio and or Braille. So, but it's an incredible program.
You mentioned what's worked for some people is adding those special dots as a way for like a tactile type things to kind of help them, especially with light switches, right? If you have 3 in a row, putting 1 or 2 so that the person can just kind of like feel. I thought that was brilliant. That's really brilliant. Is there a particular type brand that that you think is much more sturdier than others, or would a simple sticker work?
So if you go into a couple of the resources I mentioned, one was Independent Living Aids, and you can go online to their website, and the other was Maxi Aids. And on there, you can see they break things down by section. So they have resources for hearing loss, resources for mobility disabilities, resources for vision. And if you go into the section for vision, you'll see a section for tactile. And under that tactile section, you'll see a variety of things. One of them being either, again, they'll call them locator dots, raised dots, lock dots for short. And you'll see that there are different sizes. If you remember, like dot candy, okay, so the dots candy that comes on a piece of paper, they're kind of like that, and they come in different sizes. There's really tiny ones you might even put on a keyboard, like on the F and the J, right? You might put that on a keyboard. And so that gives you kind of, even though most keyboards have something a little raised, sometimes it's not high enough. So this makes those 2 keys a little higher to keep you on the home row key, right? So you might get the little dots for that. You might use maybe a little bit larger dot on, let's say, the start and stop and 4, 5, and 6 of your microwave, just as kind of like a framework for moving around your microwave. You're not going to put on every number because then it becomes less helpful kind of that way, right? But if you give yourself a framework of where things are, you can move up a little for 1, 2, 3, down a little for 7, 8, 9. And those kinds of things become more of a tactile guide for you. And so you can find those kinds of things. They're self-adhesive. You pull them off the paper, you stick it on, and then it pretty much stays on there forever and ever unless you pull it off, wedge it off. But it doesn't damage or anything like that. And it won't stick to a wall. So it's going to be like on the light switch. It's going to be on the microwave. It's going to be on an appliance, something like that. It sticks best to. And then you can also find that concept. You can find those different kinds of things when you look on Amazon and eBay. And then again, like I said, you can kind of price compare, and you can compare what kind of sizes. And some of them can sell colors. Like sometimes you'll find a bright orange version of it. And if that's something that's helpful to you, find where you want to be, then that could be the purchase you want to make.
Key takeaways, okay, for people to help them, people who are becoming more and more visually impaired,
Okay.
and want to reduce their loneliness and increase their independence. What are 1, 2 key takeaways that you want people to have?
I think a key takeaway is if you are beginning to experience vision loss, do seek out your state's or your county's vision rehab services. So I'm in New York, and we have something called the Commission for the Blind. Okay. In your state, you have something to that effect at the state level. And what they will do is they will work with you to assess your vision and then your vision needs. And depending if you are a person who is still in the workforce, they will work with you to assess your needs as to what you might need to continue working. If you are a person who is not in the workforce, then they will work with you to assess your daily living needs within your home environment. So that would be from a really important perspective to seek out that resource. And the other resource, which honestly may not be available everywhere, but you may find something online if it's not locally, is some type of support group. Sometimes support groups can have a negative element to them because people are sad and people are frustrated and people are overwhelmed. But many times, a good support group will bring in local resources, local speakers to talk about different types of things. And the main thing being, how do you do this? How do you do that? How do you do this? How do you do that? Right? We all do things differently, and we all have very different kinds of needs that go along with our vision loss if we're experiencing that, right? So it's not just the vision loss. We may have to take other things into account. I think it's really important not to allow yourself to become isolated. That only makes all of the negative aspects of it worse. And then the other thing that I think of that I'll mention really quick that I didn't mention before is many people over the years come to me and they're like, well, I can't see TV anymore. Traditionally, our TV viewing rooms are set up that the couch is on one side of a room and the TV's on the other. And they say, well, I'm right near the TV. I'm only, 3 feet away. Well, sometimes 3 feet is too far. So you may, if you can safely do it, you probably want to be able to take some kind of comfortable chair, recliner, whatever that is. And I'm just going to move a little to show you and really kind of put that sideways by your TV and be inches from it. rather than feet from it. And maybe that won't help you to see every aspect of it, but it will be more engaging for you and help you to at least see what's happening on the screen. So you may want to try something like that if it's safe for you to move, a piece of furniture to a different location in the house. But that is a big problem that people have, and it does isolate them more because they feel no interest if they can't see the TV from where they are.
I want to thank you again for being on the program.
I hope this is helpful to everyone and that you are able to utilize these resources in your daily living needs.
I want to thank the Quincy Health Department for continuing to sponsor Aging Strong.